Greetings, my fellow Dreamlord Sovereign Thinkers. Thank you for tuning in to LO3 Podcast. My name is Craig, transmitting from the beautiful swampy Mangrove, South Florida, and today's date is Thursday, June 10th, 2021. I was just browsing my phone, had to take care of some little business, moving stuff around. So I'm kicking back right now. I'm outside. Nice little breeze for June, and I do enjoy it. Trying to take care of my foot. It's a little swelled up, but things are not as bruised, so hopefully everything will rescind as soon as possible. But I just got this report from the Epoch Times, and this is very interesting here when they were actually talking about the shots. Okay, so it says here, given by Zachary Stieber, and this is entitled "Nearly 800 Reports of Heart Inflammation After COVID-19 Vaccination in the U.S." Federal authorities have received over 800 reports of heart inflammation in people who received a COVID-19 vaccine, a health official said Thursday. Reports of myocarditis or pericarditis were submitted to the Vaccine Adverse Event Report System, a passive reporting system run jointly by the Centers for Disease Control and Prevention and the Food and Drug Administration through May 31st. The bulk of the reports describes heart inflammation appearing after the second of the two doses of either Pfizer or Moderna vaccines, both of which utilize messenger RNA technology. Authorities stress that anybody can submit reports through a reporting system, but authorities have already verified that 226 of the reports meet the CDC's working case definition. Dr. Tom Shimabukuro, a deputy director at the agency, said during the presentation of the data, follow-up and review are in progress for the rest of the 285 case reports for which the disposition was unknown at the time of the review. 270 patients have been discharged and 15 were still hospitalized, officials said. Myocarditis typically requires hospital care. No deaths were reported. The CDC announced last month that it was investigating reports of heart inflammation in teenagers and young adults who received the COVID-19 vaccine, though it looked no definite action besides saying it would continue reviewing case data. An advisory committee to the agency, the Advisory Committee on Immunization Practice, said in a little notice update published dated May 24th and published on June 1st that data from VAERS showed that in the 30 days following the second dose of the mRNA vaccinations, there was a higher number of observed than expected myocarditis or pericarditis cases in 16 or 20 to 24 years old. Data from Vaccine Safety Data Link, an active reporting system that relies on 9 healthcare organizations in 7 states, did not show higher than expected cases, it added. However, analysis suggests that these data need to be carefully followed as more persons in younger age groups are vaccinated. The Advisory Committee's Vaccine Safety Work Group said in its report. Israeli Health Ministry said that same day it found that 275 cases of heart inflammation among more than 5 million people in the country who received a vaccine between December 2020 and May. The Israeli study found a probable link between receiving the second dose of the Pfizer jab and the appearance of myocarditis among men aged 16 to 30, the ministry said. Shimabukuro said that the U.S. passive surveillance data are consistent with the surveillance data that emerged from Israel. The figures are also consistent with other case reports and data from the Department of Defense. The vast majority of the U.S. reports deals with male patients. Approximately 300 preliminary reports indicated that patients suffer chest pain, with nearly as many having elevated cardiac enzymes. A case report examining myocarditis in 7 adolescents following vaccination with Pfizer jabs, published in Pediatrics, the Journal of the American Academy of Pediatrics this month, and said all 7 developed the inflammation within 4 days of receiving the second dose, did not have evidence of COVID-19 infection, and did not meet the criteria for the MIS-C, a rare disease. MIS-C, they call it. 7 males, ages between the ages of 14 and 19, all required hospital care, but each was eventually discharged. Authors did not respond to requests for comment, said no link has been established between the vaccines and myocarditis, and that the benefits of the vaccines outweigh the risk. But they also urged healthcare workers to consider myocarditis in the evaluation of adolescents and young adults who develop chest pain after COVID-19 vaccination. So what they're saying, they're not 100% guaranteed, okay? So I'm going to continue on here. A commentary on the study published in the same journal said there are some concerns regarding this case series that might suggest a causal relationship and therefore warrant further analysis, though established surveillance system. First, a consistent timing of symptoms in these 7 cases after second vaccination suggests a uniform biological process. Second, the similarities in the clinical findings and laboratory characteristics in the series suggest the common etiology. Finally, these cases occurred in the context of a dearth of circulation of common respiratory viruses known to be associated with myocarditis, and thorough diagnostic evaluation did not identify infectious etiologies, they added. The expected number of myocarditis, pericarditis cases in those age 16 or 17 based on background assistance rates and the numbers of doses administered to that population through May 31st is between 2 and 19, but based on the VAERS reports, the number is 79. Likewise, the expected number of cases among young adults between ages of 18 and 24 is 8 to 83. The number is based on the report is 196 in the 16 to 17-year-olds and the 18-year-old to 24-year-olds. The observed reports are exceeding the expected based on the known background rates that are published in literature. Shima Burkuro told the members of the Food and Drug Administration Vaccine Advisory Committee in the meeting on Thursday, though he cautioned that not all the reports will turn out to be true. Myocarditis and pericarditis reports. Of note, these 528 reports after second dose with symptom onset within 30 days, over half of them were in these younger age groups, 12 to 24 years, whereas roughly 9% of total doses administered were in those age groups. So we clearly have an imbalance there, he added later. Data for vaccine safety data link, which comes from 9 healthcare groups that have collectively administered over 8.8 million doses. Only some of 284,000 of those have been given to 12 to 17-year-olds. Did not indicate safety concerns, and with just 60 myocarditis or pericarditis events reported through May 29th, the doctor continued. The Food and Drug Administration surveillance system, the Biologics Effectiveness and Safety Initiative, which utilized claims data from CVS and 2 other partners, had detected 99 cases of myocarditis or pericarditis in the 42 days following the vaccination among some 3.1 million shots given to people between the ages of 12 to 64. The panel was told earlier by an official from the drug regulated agency. Another 1,260 reported in people 65 or older through claims data from Medicare claims data. Neither number raised safety signals. Steve Anderson, director of the FDA's Office of Biostatistics and Epidemiology, said. Dr. Cozy Meisner, chief of the Division of Pediatric Infectious Disease and Tufts Children's Hospital, and member of the panel that heard from Shima Burko and others said that after the presentations that he was struck by the fact that myocarditis occurs more commonly after the second dose. It's pretty specific interval of time. It's primarily after the mRNA vaccines. As far as we know that the consistent age, there's a lack of alternative explanations. Even though these patients have been pretty well worked up and it's a widespread occurrence because, as you said, Israel has found a pretty similar situation. He said during the meeting, he asked Shima Bakuro about the rates of blood clots seen in women between the age of 30 and 49. After vaccination, most of the clots appeared. That population after getting a Johnson & Johnson shot, though officially ultimately lifted a pause, saying the benefits outweigh the risk, and to restate the rate of incidence of myocarditis in adolescents after the jab. Shima Burko said, in the contrast with the clotting situation, when data showed strong evidence of a causal relationship fairly early on, further study is needed on heart inflammation. Doing some order here at this point. I think we're still learning about the rates of myocarditis and pericarditis. We continue to collect more information on both VIRS and continue to get more information in VSD. And I think as gather more information, we'll begin to get a better idea of the post-vaccination rate. And hopefully we will be able to get more detailed information by the age group. It is still early, he added, noting that authorization for a vaccine from 12 to 15 years old didn't come until mid-May, while immunization of older adolescents largely came later than shots of adults. I believe that we will ultimately have sufficient information to answer those questions, he said. Another panel member, Dr. Jay Portnoy, director of the Division of Allergy, Asthma, and Immunology at Children's Mercy Hospitals and Clinics, asked for comparison between the adverse events in vaccinated versus unvaccinated persons, saying if the adverse event rates was lower than those who are vaccinated, then it would still be worth getting a jab. Shima Burko, a risk-benefit assessment would provide the CDC's advisory panel, known as ACIP, on vaccines during the meeting next week. A CDC spokesman who referenced the upcoming meeting, which will take place on June 18th, after saying reports of myocarditis remain rare, given that over 300 million doses have been administered in the United States. Given the number of COVID-19 vaccine doses administered, these reports are rare. More than 18 million people between ages of 12 to 24 have received at least one dose of COVID-19 vaccine in the United States, she told the Epoch Times via email. The CDC continues to recommend COVID-19 vaccination for every 12 years and older. Getting vaccinated is the best way to help protect your family from COVID-19. A Pfizer spokesperson told the Epoch Times in an email that the company is aware of the federal data indicating rare reports of myocarditis and pericarditis, predominantly in male adolescents. I always mispronounce these words here. And young adults after mRNA COVID-19 vaccination. Note that federal officials have not concluded that mRNA COVID-19 vaccines cause either condition before expressed support for the assessment of suspected adverse events with a vast number of people vaccinated to date. The benefit-risk profile for our vaccine remains positive, the spokesperson added. Moderna did not return an inquiry. Dr. Monica Gandhi, professor of medicine, associated chief, University of California, San Francisco, to the Epoch Times that in an email that the light of the increased risk of myocarditis above expected rates among young people, especially after the second dose, parents should keep a close eye out when guidance is issued by federal authorities. Possibilities include only vaccinating children with prior infection, as there is an association between prior COVID and their adverse effect, giving one dose instead of two. below the age of 20, addressing the dosage of the vaccine currently at 30 micrograms down to the age of 12 with the same dose as an adult, and extending the duration between doses in 1 and 2 for younger people, she said, looking forward to ACIP guidance when it's over the next few weeks. Interesting there, so always got to look at these areas, folks. This is totally nuts. Totally nuts. I'm like, good grief. Wow, man, so hey, you get your free shot, you get free symptoms. Ain't that beautiful? Wow, man. And I'm not being arrogant about it, but I just find this really like in Twilight Zone, bizarro world, all right? When they're trying to bribe us with guns, lottery tickets, and all this good stuff, and ice cream. Bro, I gotta tell you this. It's far downright blasphemy. That's how I see it. It's just all those things. I find it absolutely condemning with a passion. And hopefully many out there are following through on complying. And even there's one doctor who's a pro-vaxxer wasn't really too fond of it either. And all you gotta do is look these interviews up. It's very amazing. So it's not some keyboard warrior conspiracy theorist. Always question these things. All you folks got to be safe, and there's always natural remedies, and consume inflammatory foods as well in your system. So I got to do the same thing. And that will be it. I thank everyone for listening. Plus, feel free to download and share us throughout your social media networks. If you have any questions, comments, or something that's interesting you want to check out, whatever you do, please send your correspondence to the Quorum. Furthermore, I'll leave the footnote of this article on my Spreaker page. If you want to contact me, you can go to LokiLuckNumbers03@protonmail.com. If you want to do a donation, you can hit me at paypal.me, cash.app/LokiLuckNumber3. If you want to contribute to the Epoch Times or subscribe, I say go for it. I endorse these individuals thoroughly. They're great work. They do great jobs. Look at all sides. No partisan bias by any means. All right. Once again, thank you for your time. Plus, always remember that the demoniac resistance is healthy for the soul and can liberate humanity. Until next time, take care of yourselves. Keep on spreading love. And may your guardian spirits be with you.